We go.
All right. Good afternoon, everybody. I think what Katie would like me to do is go ahead and introduce the panelists and greet everybody this afternoon. So obviously we are smack dab in the middle of our healthcare negotiations with MMB from the state of Minnesota, as well as the state employees group insurance program, which is famously known as SEGIP. As we've communicated over the last several weeks, we're in a very difficult situation with our health insurance negotiations. So we wanted to make sure that we provided an opportunity for all our members that are participants in the state employees group insurance program to get an update on the negotiations from Local 320 in particular, particularly our representative, your representative on that joint labor management bargaining team, Katie Jackson. What I want to do is go ahead first and introduce who your panelists will be today. First, I am Brian Aldies, the Principal Officer and Secretary Treasurer of Teamsters Local 320. Next, I'd like to introduce a business agent from Teamsters Local 320 and our representative on the Joint Labor Management Group that participates in the State Employee Group Insurance Program negotiations, Katie Jackson. And Katie is formerly a member and employee at Minnesota State University in St. Cloud. Next, I'd like to introduce Christy Madro. Christy Madro is a business agent with Teamsters Local 320. We're blessed. She joined all of our teams here early part of May. Katie is also formerly an employee at Minnesota State University located in St. Cloud, as well as the statewide president for the Administrative and Service Faculty Bargaining Unit that Local 320 represents. And last, of course, but not least, all of our representative at the Capitol here in St. Paul, but Ed Reynoso. Ed Reynoso is the legislative and political coordinator for Teamsters Local 320. And just to give everybody a little bit of a rundown on the agenda for today, but we will be provided with an update today on the state employees' health insurance negotiations by Katie Jackson. And then, of course, Ed Reynoso and myself will be piggybacking off each other and providing a little bit of a historical background that led up to the issues that we've had to deal with regards to the prescription benefit procurement process that SEGIP uses to provide the prescription benefit to all of its stakeholders across the state of Minnesota. So with that, I'm going to go ahead and turn it back over to Katie Jackson.
Thank you so much. That was a really great introduction. The only thing I would add is that both Christy and I spent a lot of years on this same plan. So as you know, I'm at the table. Please know that I have lived being on this plan. I have lived the struggle of, going through the prior authorization process for unique needs. And so please note that that experience has been really profoundly helpful at the table for bargaining and representing all of you there, which I'm honored to do. Okay, so insurance bargaining. So for those of you who maybe haven't had the opportunity to participate in a bargaining process, I thought it would be really helpful just to give you some common terms that I might be using throughout this presentation. I know it's really hard to listen to some of this stuff because there are some complicated things, especially when we get to Ed that he's going to talk about today. But when I refer to a proposal, that's really our written or verbal offer made by either us or the state that would change or outline contract language that would impact the insurance. You're also going to hear me talk a little bit about packages. And so it's very common for both sides of the table to put together a package or an offer that would encompass different proposals that we've written, either keeping them or dropping them. And then to also suggest that the other side may keep or drop a proposal, right? And so that's how we give a package back and forth when we're actually at the table and in the heart of negotiations. Tentative agreements, which I'm happy to share that we did come to a tentative agreement throughout that 5-day process, which we'll talk about later. But that's really a proposed agreement reached between the negotiating parties, but of course subject to final ratification. And then we also experience a lot of different moments where we caucus during the process. And that's just really a meeting for our group when we pull apart from the employer to talk about what's happening, to maybe develop more proposals, and really, I don't know, have lunch. Those things are part of caucusing. And so those are some terms you're going to hear me refer to today throughout this presentation. Wanted to make sure that everybody had the same framework here. Okay, so for insurance bargaining, so I thought it would be helpful to talk about who. So the Local 320 represents over 2,300 employees who participate in the SEGIP plan, right? So that's a great deal of members that we're representing and impacting throughout this process. Those members include professionals in public defense, the Minnesota State Administrative Faculty, State Court Administration, the Guardian Ad Litem program. And so just to give you an idea of who's also in this space with us today as we go through this presentation. So in this process, we're members of what we're calling a union coalition with many other union leaders. And so, of course, it's a great opportunity to see what other people's priorities are throughout this process and really meet some people across the state who are representing other groups. So we really worked as a group to prepare proposals and actively participated in each session in making decisions as a group. The group does talk about how to vote if we're really conflicted. I'm happy to say that we really were never conflicted because when we get into a voting process, it's really about how many members are in your unit is how many votes you're going to get at the table. But again, we didn't have to go there. So then I also serve on something called Joint Labor Management, JLM. And that is really a subgroup of this that meets throughout the year to address smaller issues. As we move through the process, we meet directly with MMB. They will oftentimes call us together to report different things to us. So when and where, so we've had 5 bargaining days total after the financial presentation from MMB. And we have been having these meetings at the AFSCME Council 5 building in St. Paul. So I thought it was also important to maybe address why we bargain this way. And so really Minnesota state statute determines how this happens, right? And so the union coalition meets before it gets to the point where it has to go to AFSCME to be the final packager of what's going to happen through their negotiation process. And so that's why we do it this way. And really the coalition does a good job of working to represent everybody's proposals, and our priorities are very similar, right? We are concerned about the financial impact, and I think that's what we've been hearing from you all throughout this process is what is it going to be financially for us? Okay, so insurance bargaining, there was a lot of back and forth every day that we met. So we would put different packages together that would remove some of the things the employer wanted, add in some of the things we wanted, and they would do that back to us. At the end of the presentation, you're going to see a QR code that will help you get to all of the days of bargainings in a Google Drive that will lay out for you all the packages, all the passes that were made, if you have any desire to go through those documents. Okay, so the financial impact, right? It is really, it's bleak. And I know that you all have been very concerned. We've also been very concerned about the financial picture. So for insurance, they are proposing with their current first proposal and second proposal, those are their financial proposals. Under their current proposal, a single family total out of pocket for the year would be around $1,300, which is a significant increase of over $800 compared to what's happening right now for people. When it comes to the family out of pocket, that would raise to $5,200, which is like close to $2,000 more than the yearly out of pocket for our members currently. You will see in the documents that are available to you through each day of bargaining different overviews from MMB about the financial situation, and that's where we are gaining this information from. So I think a good question to answer too in all of this is, what happened? How did we get here? And I think that there are a lot of reasons why MMB ended up in the position it's found itself in. So they have a company called Deloitte that helps them kind of prepare for the year, run estimates, figure out what they should be planning for financially. And it is clear to me throughout this process that Deloitte made many mistakes. It was even more evident in the fourth day of bargaining, where they came to us immediately saying that there was a financial mistake that was made. You will see that in our documents as well. So they underestimated the cost to the employer, but did not propose changing any of the premiums to the plans. So effectively, what's going to cost the employer money, right? That pot of money that they're going to pay either to wages or to insurance is being even more so impacted, while our premiums are still staying high. I do want to pull up another document to share with you all on the screen. It might take me a second to do that effectively, because a few things of concern that I have to point out to the group today really relate to this chart right here. And you will see this in the documents. This is the most accurate one after they were able to fix their mistakes. And you're going to see that in the file system that I made. And it will be labeled like 521 because it was yesterday. So the deductibles in some cases are close to tripling. Another area of concern that we had as your representation is under the hospital services. The idea that your copay would be this expensive is just atrocious and would end up harming the plan in the long run, right? People are going to avoid going to the emergency room, and that's really not what we want for our colleagues. I want to see if anybody has any questions in the chat yet. It looks like nobody's asking anything. If you have questions, go ahead and put them in the chat and we'll do our best to. Okay, Q&A. Let's see. The single out of pocket is 1,700 right now, and the family is 34. I'm confused by your differences. Valid. So a lot of the math that I have done is related to what I was looking at through specifically some of our impacted employees at the part of ASF. If there are numbers you would like me to run for your bargaining unit, I can do that. Can you zoom in a little? Again, this document is available to you. Lots of requests to just make the document bigger. I think I've done that. Other panelists, are you able to confirm? Okay. Yeah, so I have every intention of sharing our recorded presentation out to all of the impacted groups. I've also made a Google Drive that houses all of the documents, all of the passes by day at the bargaining table for you to go through at your leisure. Where do we find the documents? At the end of the presentation, I will be sharing a QR code. And if that doesn't work for you, I can also email out the link to get to it when we share the video. Oh, okay, John. Yep. I was like, I thought I did it. I was like pretty certain I did it right. So thank you for throwing that out there again. Ooh, someone says you can also zoom in on the screen with your fingers independently. I guess if you have a touch screen though, right? Well, no, you could do the, okay. Awesome. All right. Any other questions from the group related to this? Again, you will get all these documents. I will share the recorded video. You will also get, yeah, you're going to get everything we've got and seen at the table. Go back to the presentation. Okay, so what happens next? So we have had 5 days of bargaining. We were unable to touch anything related to the financial proposals for a few different reasons that I think are important to share with everybody here today. So obviously, Deloitte has made many mistakes in this process. They've also not given all of the financial information that we need to be able to see to make any sort of decision around what we can or cannot bargain for in the process. And so we're waiting on that information. Also, the lack of the state budget had a huge impact in this as well for us to make any sort of difference. Um, Something you'll see in their materials is that they, in their reserves, they spent down to where they were comfortable spending down to faster than they projected. Those projections were made in collaboration with their company, Deloitte. And so the reason things have gotten critical, right, is because they're now projecting that healthcare is going to be more expensive. And they've also really spent down all of their reserves to where they are getting uncomfortable. So they're trying to make up that difference. Okay, so what's next? We've got push week, which is really AFSCME as they go into bargaining. This is the week that we are going to need to collaborate with the union coalition to make any sort of difference at the table. Of course, I'm looking for some help. If anybody is willing to help organize some events or just be willing to get out there and help us with whatever we need to keep this impact low on all of our impacted employees, please use the QR link to sign up. I will send out the form as well if you're interested in hearing more or participating. We need as many leaders as possible to make a difference here, and so I hope to see a lot of you signing up to assist me in that. We, at the end of the day yesterday, did share what our priorities were as they move through their next steps in the process. And so our request was that they keep premiums low as they can, right? So that monthly out of pocket that we're seeing less impact there, lower the emergency room copay, and then work on redistributing some of the cost share within the deductibles. Again, materials are in this QR code in a Google Drive. You should be able to access it. If you have any problems, of course, I'm available to you and you can reach out to me via email and I will assist you in getting into those files. You all will be given viewing rights. Okay, I want to hand it over to Ed to talk about some legislative updates. There are some other things really impacting the insurance world that we find really important to share with you today. Ed.
Thank you, Christy. I think, Brian, you were going to go first, if I'm not mistaken, correct?
You're just on mute, man.
All right. I think we got the mute fixed. So Ed, Katie, thank you, Katie. Very good very good presentation. And I know that it's great that people have access to the information, so thank you for that. And obviously, as people have questions, please don't hesitate to reach out to Katie with regards to what's been presented at the insurance bargaining table. And then if you have any questions, and you may, because the topics that now that Ed and I will cover can be very confusing and they're very technical. So I'm going to go ahead and dive into that, but don't hesitate, obviously, to reach out to the local union, and Ed and I will do our very best to answer any of the technical questions regarding the prescription benefit procurement process. So what I want to do is I'm going to start by taking us back to 22-23, and then I'm going to go back to 2021, and this should tie everything together and help give people a picture of why we're at where we're at with some of the issues centered around the health insurance. First, Katie talked about SEGIP and MMB wanting to draw some of those reserves down. As a result of drawing those reserves down, we were able, the last round of health insurance negotiations, to have a very nominal increase to the health insurance premiums. In addition to that, we were able to add a benefit to the stakeholders in SEGIP, which was a zero deductible or zero copay to access the mental health benefits through your health insurance program. Reason being is reserves, SEGIP reserves, were projected to be $450 million. Reserves are important, and a healthy amount of reserves should cover somewhere between 9 to 12 months of what actual claims are projected to be. So that way the plan stays healthy, particularly with unpredictable claims and events to the health insurance plan. The drawdown to 300 million, which would be a healthy amount of reserves, was done in a way so that it was projected to hit the 300 million mark by 2027. It's 2025, and they're near the projected 300 million mark. So claims have been considerably high, particularly with the GLP-1 drugs. And GLP-1 drugs, so everybody knows, are essentially your designer drugs, weight loss drugs like Ozempic, the non-generic drugs for diabetes, cancer, things of that nature. So that's a small picture or a brief picture of what happened and why we're at where we're at. And then a little bit about what happened during the 22-23 health insurance negotiations. Going back to 2021 now. So back in 2021, the local union was contacted by an individual by the name of Mark Bloom from America's Agenda. America's Agenda is a nonprofit organization based out of Washington, D.C., that assists unions in their states to craft and pass legislation that requires the state health plans to utilize a technology platform for the procurement of prescription drug benefits through a reverse auction process. We were also contacted by a lobbyist, Buck Humphrey, who specializes in healthcare and prescription drug legislation information, that type of thing. They did a presentation for us and explained and showed to us what doing and requiring a reverse auction process to be utilized can mean to the stakeholders. Stakeholders being the participants in the state employee group insurance program. They were successful with passing legislation in states like New Hampshire, New York, New Jersey, and they're also working on it in the state of Colorado as well. In New Hampshire, savings of tens of millions of dollars. In New Jersey, it saved the state's health plan over $300 million. In Minnesota, they had identified a potential savings to the stakeholders and the plan, potentially of $60 million. So we engaged in the process, and Ed and myself and others from the local union worked tirelessly to pass legislation in the state of Minnesota back in 2021 that would require SEGIP in the state of Minnesota to use a reverse auction to procure its prescription drug benefits. What the process does is it utilizes a technology platform that the state has to engage in, so a third-party vendor, a technology vendor, where prescription benefit management companies are essentially bidding against themselves for the state's health plans business, in theory, to drive the cost of drugs down, whether they're the GLP-1s or other formulary drugs. They went ahead and they conducted those processes here in the state of Minnesota after the legislation was passed. The legislation also allows the state to carve out the different formularies. So they could carve out the GLP-1s or other formularies to procure a benefit that is less expensive than it would normally be through just the single vendor. So in part, utilizing that process was successful. It's after having the third-party technology vendor give us access to the report, we've identified that at a minimum, through rebates and lower cost drugs to our stakeholders, SEGIP saved roughly $23 million. Those are dollars that the stakeholders and their unions then are given the ability to utilize in their health insurance negotiations with their employer to keep premiums down, to provide other or new benefits, lower cost deductibles, co-pays, things like that. But what we also learned from that report is that SEGIP and MMB did not carve out the GLP-1s or other formularies. And we saw that based on the costs of those drugs. In other words, the claims experience for those drugs were extraordinarily high. And they did not carve those out. We believe that we still have room to grow in this process so that we're able to realize further savings. Because in addition to the $23 million savings through rebates and things like that, we've also identified that there was an additional 4% savings to the plan because they utilized the reverse auction process. The technology platform that the state is using currently is the same technology platform that Mark Cuban's prescription drug company is utilizing and will identify significant savings. So in the end, it is our goal for the state to continue to be required by law to utilize the reverse auction process for its prescription benefit procurement process. And Ed, with that, I want to turn it over to you now then to talk about the current, the legislative session that we currently went through and talk a little bit about, or talk about what the outcome was, what the situation is with the reverse auction process.
Thank you, Brian, and thank you for providing that summary. You know, it's a 30,000-foot level view, and there's a lot of other intricacies that are involved. But I really want to point out a couple of things. One, that unfortunately, because look, the reverse auction process worked as it was supposed to. What happened was it wasn't implemented by MMB as the way it should have been, specifically on the carve out. That carve out could have provided a lot more savings. And is that the crux of why the costs have gone up? I don't think it certainly helped the situation by any means. But you know, and so we've been fighting, both myself and several other people have been fighting with MMB on this prescription drug process, specifically the reverse auction, for the last 2 years. And what happened last year was they came to the Capitol with a bill that would have changed some of the parameters on how the process went. And their thought process was that they wanted to make some changes that they thought would improve it, but without having the full report back. In the legislation asks, required, should I say, specifically a review by the legislative auditor, and then subsequently a report to the legislature by MMB. And so without having that, it actually required it by this year, by this legislative session. So last year, they didn't have that information yet. So to be able to make any decisions on changing some of the parameters would have been premature. And so we fought hard then. And in opposition was many of the other unions that wanted to move forward on some language that that would have, in some essence, gutted some of the system too. So we fought last year and we won, by blocking them by not being able to change the legislation. This year, they came back with the legislative audit report to the legislature, and then MMB provided their report to the legislature. And we believe that there were some inadequacies and some misinformation or lack of information that was part of that process. And it turns out we were correct, because Traveris, which is a technology vendor, it turned out the MMB didn't provide them an opportunity to give them an overview of what the impact was, pertaining specifically to the price cost and the lack of a carve out. And I think that personally, I think MMB did that purposely because they didn't want to be exposed at not using the access to that carve out. I mean, think about the cost of the GLP-1 drugs alone from 3 years ago when this was started to now. And the increase on those GLP-1 drugs, whether it's for diabetes or for weight loss, and it's the other GLP-1 drugs too, not just, it's all of them. And on top of that, as Brian said, cancer treatment drugs, HIV drugs, they're extremely expensive and they never go down. So the savings had to have been significant had they implemented it the way they should have. And so we have a big pushback with MMB on why they didn't do that. So we come back this year and they give the report, and on top of that, they talk about some language that they would like to conceptually move forward. They had concepts of a plan, but to be honest with you, that they presented to the JLM, but didn't go into detail on what the legislation was going to pertain to and how it was going to work. They subsequently introduced the bill 3 days before the deadline. Senator Mann uh, presented the bill, and they had a hearing on it. We testified in opposition to it, and the main reason we wanted to oppose it, not only because it was going to literally gut the entire system, but it was also going to take our ability as the JLM to have any input whatsoever. And I want to read this real quick, the legislation. It was Senate File 3055. And in a nutshell, in subdivision 3, it said, for subsequent procurements, if the commissioner intends to separate prescription drug benefit and pharmacy benefit manager services to multiple vendors, or intends to fold prescription drug benefits to the overall medical benefit rather than the single full service pharmacy benefit manager, this section shall not apply. It removed the entire section of subdivision 3, which included the language that pertained to the JLM having a voice on the decision making, whether we do a reverse auction or not. And that was their whole intent, to do away with the reverse auction, because they screwed it up so bad that they wanted to do away with it and possibly go back to the old system we had. The reality is reverse auctions work. They are effective. And if they are implemented correctly, and so on top of that, they wanted to split the vendors. In the reverse auction process, you have the technology vendor, and you also have a vendor that you could have a different vendor that that provides the reconciliation, basically auditing to make sure everything was done correctly. Historically, it's been done by the same vendor, which was Tavares. And they wanted to split that up and give it to who? The company that is screwing everything up already, Deloitte. So we were adamantly opposed to that section also. So we were adamantly opposed from the very beginning, and we testified in opposition to it. But here's the kicker. We have a JLM in place to provide information and provide advice to MMB, and wanting to take them out of the conversation was terrible. But here's the worst part, is when they showed up to testify at the Senate hearing, they straight out lied. And they said that the JLM had given them the green light to go forward with this legislation that would basically take the JLM out of the equation and then split the vendors up. I'm sitting at that hearing, and we were already going to testify in opposition to it because of our issues. But I literally went up there and called them out, because we had some people within the JLM that were providing them the ability to say that they had got the green light, but in reality, they never presented this to the JLM in order to get the JLM to authorize it. In other words, there was no transparency in the process. Normally, when you have a JLM or you have a group or a board or whatever, you have a voting process where everybody knows what's going to be voted, and they know, they understand. They never did that. They never provided that. They said that they got the okay by AFSCME, MAPE, and the IFO. The fact is that the IFO and AFSCME was going out with them and trying to help them pass this legislation. And we were the only union at that point that was going up against them. It was basically a fist fight at the legislature per se, right? Um, by these unions. And we were the only one at that time taking those other three unions on. The fact is, and what won the day are several things. One, we showed legislators exactly what this legislation would do in taking our voice out of the process, which we felt was it was heavy-handed by the commissioner, and we felt it would take our voice out and hurt our members. There are over 200,000 participants in this plan, and to allow a couple unions to try to call the shots, we were adamantly opposed to. So what they ultimately did was they tried to go behind our backs, and they thought they had it done. They thought they were going to be able to get it passed, and we continued to work the system, educating the legislators, letting them know exactly what this would do, and then educating the legislators that the JLM never gave this a green light, and exposing the lie that MMB went to the Capitol with. At the end of the day, we won. And up until the very end, the commissioner was sitting there with one of our supporters to go against this bill, trying to persuade him to go against us. And he literally sat there. I mean, I'm 3 feet away from this. And he's literally telling her, I am not interested. Nope, I'm not interested. There's a lot of other stuff that took place, but the importance of having somebody at the Capitol, having somebody that understands the process, having somebody that knows how to fight back on this issue is huge. And I can tell you, it was one of the biggest battles we've had, going not only up against MMB, but going up against other unions. We're not shy, and we don't easily crumble. But not only were we able to push back, we got a couple other unions to help us out. One was State Patrol, and then the other one was another LELS, which is the law enforcement union. But at the end of the day, we won the argument because we were able to stop them from gutting this system and saying that there was a better system out there that we know isn't. At the end of the day, gutting this would have cost us a lot more money than keeping it. Now, with that said, one of the things that we have discovered in the legislation is that there is a process for them to procure another reverse auction without changing any legislation whatsoever. Now, one of the arguments at the Capitol was that they needed more flexibility in order to get another procurement for a reverse auction. We've shown them that that's not true either. There's legislation in statute right now that was the original language that provides them a no-cost reverse auction. And we have already said to them, we're willing to sit down with them. I'm willing, and Brian and Katie are willing to sit down with them to show them the path on how to get that done. We know unequivocally that there are going to be some significant savings, specifically in the GLP-1 drugs and those other carve-outs. And basically, real quick, how that works is when you're going through the procurement process, it's like eBay, but upside down. You're trying to get, they have to respond. All the bidders have to respond, but it's about who gets the lowest price on these drugs. And so what happens is when you have a carve out, it could be a separate vendor, but it's a separate separate bidding process that is done just specifically on those drugs. And the reason we do that is because there are specific companies that do specific drugs like GLP-1 drugs that have a better market. They have better access to a market that provides those drugs at a cheaper cost. And that's where the savings would come. So that's the advantage of having a carve out, and the advantage of having this reverse auction. So, I didn't want to there's a whole bunch of other stuff that goes on with this reverse auction and the PBMs, but not to get down in the weeds. And I know some people are still probably saying, I have no idea what the hell Ed just talked about, but trust me, it's a very uh, really hard process to figure out at the beginning, but once you know it, you know it. And I can tell you right now that I think the fact that we were able to block this legislation is going to pay dividends down the line for this plan itself. So if you have any questions, I don't know if there's any questions on that, the savings gap. All right, so Brian already said that. If there's any questions, I'm certainly willing to answer them. And again, it was a quick 30,000 foot overview of how PBMs work. I'm sorry, and reverse auctions work. And I'm certainly willing to have another conversation if need so. So Brian? And I guess this puts us to where we are now, right? And
Yes, it does, Ed. It puts us where we're at today. And so we've learned a lot through this process. And Ed, I want to thank you for the recap of the legislative session and what took place regarding the reverse auction. The battles that we've had with MMB, SEGIP, and some of our other labor partners. And I found it absolutely interesting that we developed, built partnerships with certain legislators that we absolutely would have never believed that could have happened. But at the end of the day, it saved us.
Yeah.
It saved all of us.
Brian,
Uh,
I'm sorry if I could just interrupt because I'm glad you reminded me of that real quick. Look, we said it from the very beginning. It's very important that we have allies on both sides of the aisle. It was not the Democrats that helped us in this. To the contrary, they were our nemesis in this, in trying to support MMB. If it wasn't for Jim Nash, a Republican in chair, vice chair of or co-chair of state government committee, we would have lost this. But because we're able to build consensus and have conversations, look, and I'll be frank with you, Jim Nash is probably against us on a host of other issues. But when we can find common ground with somebody on the GOP that helps us on this, he was the one that said, nope, I'm not interested, because he understood the impact of this legislation and how it would have negatively impacted over 200,000 participants. And that's the beauty of having a full-time lobbyist at the Capitol that is able to connect and make sure that our voice is put out there. So I'll leave it at that. Go ahead, Brian. I'm sorry.
Yep. Thanks, Ed. All right. So I think we've got about 10 minutes left, so I'm gonna be brief. At the end of the day, there are 200,000 stakeholders that participate in SEGIP. Roughly 3,000 of those stakeholders are represented by Teamsters Local 320. There was a real lack of transparency by MMB, by SEGIP, and some of our other labor partners throughout this entire process. As a result of that, it's important for us to take a look at what are all the options that are available to folks represented by Teamsters. We fall under an umbrella organization called Teamsters Joint Council 32. There are 11 Teamster local unions in that joint council, the majority being in Minnesota. We do have Teamsters that fall under that umbrella in North Dakota, South Dakota, Iowa, and Wisconsin as well. Joint Council 32 has a health and welfare fund that provides medical benefits. It's health insurance, prescriptions, vision insurance, dental insurance, short-term disability as well. What our plan is going forward is we are going to take two paths. One, as Ed mentioned, we are going to hold MMB accountable for immediately running another reverse auction in hopes that they ultimately carve out some of the formularies or the GLP-1s to providers that can provide a less expensive option compared to what CVS is currently offering. In addition to that, when we go to the bargaining table with all of our bargaining units that have stakeholders in the SEGIP plan, we will be bringing a proposal to the bargaining table that provides for those bargaining units to opt out of SEGIP and opt into the Joint Council 32 Health and Welfare Fund as an option, with the option being to participate in the Joint Council 32 Health and Welfare Fund at the election of the bargaining unit. In other words, no discretion in this on the employer's behalf. It's not that we're taking folks out of SEGIP. We want that option to be there for our members. In the meantime, we will be doing the research, taking all of the information with regards to SEGIP, in other words, the total cost to participants for premiums, out-of-pocket expenses, in other words, deductibles, co-pays, the OPM, the out-of-pocket maximum, and the cost of the prescription drug benefit, and comparing that to the Joint Council 32 health and welfare benefits. In addition to that, we'll be doing side-by-side comparisons of both plans with the options to identify whether or not there's a difference in the actual benefits that are provided by all of the different plans, and to as well to ensure that the benefits that are provided by the Joint Council 32 Health and Welfare Fund are the same benefits that you would have access to no matter where you lived in the state of Minnesota. We have done this with several bargaining units across the state and have been able to put incredible savings in our members' pockets. The fact is, when you think about the roughly 3,000 people that are represented by Local 320, all of our brothers and sisters, if those cost increases actually happen, and you multiply 3,000 by the $5,200 per year difference that Katie identified, or the $1,300 a year difference for singles that Katie identified, that is an absolute shitload of money. And it's unacceptable. It's unacceptable because there's been a lack of transparency. The legislation wasn't utilized correctly, and that is not your fault. That is MMB and SEGIP. We all know what the outcome of the legislative session was for folks that work for the state of Minnesota or its other agencies. It's a very lean economic time. It's not an appropriate time to put the burden of those mistakes on your backs. And so we will be taking both lanes simultaneously so that we're able to identify what is the best place for everybody to go. We're going to need everybody's help. So is AFSCME during their push week. Guaranteed, they are going to be fighting tooth and nail against MMB, SEGIP, and the state of Minnesota to prevent some of this. But the problem has to be fixed. A health and welfare plan that has roughly 200,000 participants cannot go belly up. And so somebody's got to be held accountable and responsible for this. If we have the ability to provide another option that provides you with the same benefit at a savings, we will make that available to all of you as well. And again, bumping up against the hour. This is a lot of information. I've been dealing, and so has Ed, with the technical aspects of reverse auctions for 4 years. And sometimes it still feels like people are speaking to us in a foreign tongue. It's just, it's complicated. And even the people that were responsible for implementing this law and utilizing it screwed it up. So we're here. We'll answer any questions you have. We have your backs, and we're going to hold these people accountable in the best way we possibly can. Thank you.
Thank you so much, Brian. I just want to throw it out there, like, thank you for your leadership around this. Same to you too, Ed. I'm really excited to see what we can do with some of these options. Clearly, like, our employers are not going to like it, but it's what's best for the employee, and it'll be interesting to see how they react to our strategies around that. So, William, I was hoping that might have answered some of your question, but I see you threw it in the Q&A again. So, was there any conversation about how many people might leave SEGIP with these large increases? I did at the table in a caucus. I did tell our leaders at the front table, like, what's the benefit for working the state anymore if this is gonna balloon so terribly large, right? And their response to me was like that, well, this is still better than the insurance, private insurance. And it's fine that they think that, but I know that we have a better option, or could have a better option for our members that isn't the state insurance. So they're about to find out, right, what that might mean, because there's a lot of us, and it would have an impact. Grant, can you email the link to the Google Drive? Yeah, definitely. That'll be in an email when I figure out where we're going to post the video. All of that will be linked. My members will want to see the information. Yeah, it's my hope that everybody opens the email, looks at the documents, and does their part to be informed. What's the overall percentage increase in the SEGIP plan when you factor in the deductible increase as well as the monthly premium increase? Grant, I'm not ready to answer that for you right now, but I can definitely take your question and work on that. Is it possible to separate GLP-1s out to a separate line? If you are prescribed them, you pay higher as an individual instead of all members paying high costs. So the conversation around the GLP-1s came up a lot. And here's my take for you all on that. That was quite clearly a way for the employer to divide us as a coalition. And it was really their strategy. We have about 10% of members across the entire plan that are using that as a way to, and they can't tell us if it's weight loss or not, right? So we've got people who are diabetic who are using GLP-1s too. And they aren't able to share with us like who's using it for what reason, right? But I think anytime you've got a large amount of people using something in a plan, like, we want to do our best to not harm those people, right? It's not the people, it's the companies making ridiculous amounts of money. And so that's really where the true problem is, and not the people needing health care.
And just to add to that, Chris, Katie,
You're good.
the reality is that's exactly why we want to carve out that really gets the cheapest price we can get for those GLP-1 drugs. And look, at the end of the day, we want our members to be able to realize a cheaper cost too, because at the end of the day, I mean, there's many people are struggling these days, right? And having to pay for some of these drugs, I mean, they're still not cheap. To a certain extent, right? And whether it's a GLP-1 drug, whether somebody's going through cancer treatment and aren't able to work at that time, whether somebody has HIV, positive, there's a whole bunch of drugs that are all part of that carve out, and that's precisely why it's so important that MMB should have implemented that opportunity, and they didn't. And there's no question that increased the cost to us significantly.
One of my coworkers just quit, and a big reason is his partner's health insurance is better. Like, Yep. So this idea that some of the people at our head table aren't seeing that is kind of wild to me. Um, Somebody said I worked in a small county before this and my insurance was a lot better. Uh, better there with guaranteed wage increases. Yep, we hear you.
And that
Grant, the
and
reason,
that
go ahead.
and that's why it's important that we look at other options. Precisely.
Mhm. Grant, the reason I ask about percent increase is that we need to use it at the bargaining table 100%. We'll be using this at the bargaining table. I agree with you. Um, So shouldn't there be a trade-off with these medications? So referring to the GLP-1, if we have large percentage increasing positive health outcomes, shouldn't our negative health outcomes be decreasing? 100% Crystal, like they just don't have any data for us on the positive impacts because it's still kind of too new in their opinion. But you're definitely right. I think like there will be long-term impacts. It's just hard to actualize those at this time.
There was a town hall or a webinar just a couple days ago, and in that webinar, they actually did say, depending on how many comorbidity issues somebody may have, they've seen a significant drop in heart attacks
Hmm.
and coronary issues and obviously diabetes. And diabetes, again, if your A1C is coming down, that's going to impact other things. So yeah, they have seen a decrease in some of these comorbidities, and at the end of the day, they just their biggest problem is the cost, right? So
Another question here. Have we compared our current and proposed plan to other surrounding state plans? How do we compare? So I can say that I was looking, I had somebody share some information about some institutions in surrounding states, and I did have, I've not had an opportunity to look super comprehensively, but I was looking at one plan in particular at an institution, and like there are trade-offs, right? So there are no premiums, but their deductibles were a lot higher, and they were a closed network, right? So they had to stay with one vendor throughout their process. And so those are just some things to consider if you are looking at comparing things or if you're digging into other data. It's all about, where is the cost going to be? Because if you're paying zero in premiums, then like those other expenses when you're using insurance are going to be a lot higher. Um, Somebody said that they've dropped 80 pounds on GLP-1 meds and no longer have diabetes and have dropped several prescription meds. Congratulations, that's amazing. Has anybody thought about getting GLP-1 drugs offshore? Definitely haven't. But maybe Grant, maybe you got the hookup for people, so reach out to Grant if you need help with that. Somebody said, when are you doing cost of living negotiations? I think remember there are a lot of different units in this call right now. So it really depends on what unit you're in. If you're in the MUSAF group, we are working actively and in the middle of negotiations right now. Somebody made a comment about maybe we were using the term designer drug wrong. So we apologize for that. I know Brian is using that term in reference to specific language with the carve out through Truvaris. So they might be using it a little bit differently, but we hear you. Thank you for correcting us. Any other questions? We've still got about 80 people around. I remember in all of these expenses, right? When these employers, when these corporations want to isolate to other people, to your colleagues, or to make you frustrated with them, right? That's our indicator. Like it's really not them. It's not the people on the plan who need the health care. We are not the problem. It's the people making all the money at the top that are the problem in the healthcare industry. It doesn't have to be this expensive. Julie, so we do need to make sure that items like tier one apply to all members. For example, members in Moorhead don't have access to tier one. Yeah, we've been fighting a lot of stuff with the tier one, tier two, in that area specifically, and know that they're on the top of our mind as we work through these processes. So somebody said, I missed it. Will they cover GLP-1 meds at all? Those were not something that were being taken off the table. But what I will say, and what I see them doing, the game they're going to play, right, is they're going to continue to make prior authorization processes significantly harder, which they've already started doing, right? So I had requested with the group to do some bargaining around prior auths because I wanted to get to the heart of that issue because it's not just GLP-1s that struggle in that landscape, it's a lot of things. And so JLM is going to be taking over that issue, which I will be on. So I am not letting the prior auth stuff go. Like I am going to hold our leaders in JLM from other unions accountable to ensuring that everything they said was going to come to JLM is actually going to come to JLM. I'm not mad about it. What other questions might we have? We still got 70 people hanging out. So it looks like there's an issue with mammograms, only covering 2 and maybe not 3. Thank you for working in our favor for lower costs related to insurance. You're welcome. We love it. It looks like everybody's kind of logging off here. So I think our Teamsters team, I think we're good to end and leave. Maybe there's one more. We should have access to healthcare and medication without the barriers that add risk to our health. By pre-authorization, it's GLP-1 drugs now, but how about other health conditions? Put on the table, same thing. Yeah, that idea that it's just going to fumble into something else. Like you're exactly right. So I have no plans on letting us leave our people using GLP-1s on the wayside. Like you still deserve coverage. Lots of thank yous. Bye, guys. Have a good day.
Bye, everybody.
Take care.
All right, have a good weekend.
Okay.